a resolution unanimously opposing the closing of the Waterfront nursing home. I'd like to say that we've joined the coalition of many groups that are already out there supporting this resolution, and I'd like to mention them. One is Coalition to Save Waterfront Health Center, which includes 1199 SCIU, Hispanics United of Buffalo, Hispanic Alliance, Push Buffalo, Coalition for Economic Justice, Holy Cross Church, Voice Buffalo, and many others. As I mentioned before, Kaleida Health has submitted an application with the New York Department of Health asking permission to close down this facility. They cited the number one reason is the cost of doing business and the Medicaid reimbursement from the state, which has been reduced, making it unaffordable to continue to do business there at that facility. What we're asking the state representatives and the governor to do is to be more creative in finding a solution where the reimbursements can stay up for cities like Buffalo and urban areas. This unfairly targets inner cities, urban areas, based on the formula that we have right now. And what we're seeing over the past years is the closing of many long-term facilities for seniors that have been closing down, such as the Episcopal Home, Nazareth, Grace Manor, and St. Joseph. This is an early warning that if we don't deal with this problem, the reimbursement, continue of cutting the reimbursement rates, we're going to see more nursing homes close down in inner cities throughout the state. So we ask our legislators to oppose any cuts in Medicaid reimbursement and to come up with creative solutions so we can keep health facilities like the Kaleida Health, the Waterfront Nursing Home open. And the other thing that adversely affects are the folks that are staying at these facilities. We have lost literally thousands of beds and thousands of employees that we've lost as a result of closing of these centers. That means that we have to go and place our elderly folks, our grandparents, our uncles, aunts, in facilities outside the city, and then we have to go out there to make sure that they're being taken care of properly. I think that is unfortunate that in their late years we have to worry about our elderly folks, particularly in the city of Buffalo. So we ask that you join in with us in making sure that the facilities in the cities, the long-term health care and skilled facilities for senior citizens remain open, and that we tell the state do not approve the closing of this facility. Today I have a number of speakers that are going to be speaking. The first one is going to be Mr. David Caban, who is the chairman of Hispanics United. Thank you.
Good afternoon. My name is Dave Caban. I'm the board chairman for Hispanics United of Buffalo. But this afternoon I'm speaking on behalf of the Coalition to Save the Waterfront Healthcare Center. We'd like to thank each and every member of the Buffalo Common Council for joining the coalition to save this desperately needed community asset. Our community thanks you, and the elders who are cared for at the waterfront especially thank you. Late last year, a coalition of community, faith-based organizations, and concerned citizens was formed to advocate on behalf of the waterfront, which is the last existing long-term care facility on the west side of Buffalo. The coalition has since reached out to our governor, Mr. David Patterson, as well as
passing of the resolution. This acknowledges the importance of Waterfront, not only to this community on the west side, but to the city of Buffalo. On behalf of the employees and the residents at Waterfront, again, I would like to say thank you very much to the Buffalo Common Council.
Stand against some of these Medicaid cuts. This has been a whirlwind 60 days for us. Since the coalition has come together, I want to thank Kaz Rodriguez, David Caban, and the coalition 1199. We are working together to find a solution to save Waterfront. We have been working very hard for the last 60 to 90 days. It's quite ironic today. The governor came out and said the state budget is $750 million short on top of what the previous deficit was, and he cites escalating Medicaid cuts. That clearly impacts a place like Waterfront. A little bit of history on Waterfront. The facility returned a small profit in 2006 of about $180,000. Since the budget deficit of 2007, the facility's lost over $2 million. Clearly, this hits the most those most vulnerable.
¿Cómo estás?
Lo más bien, gracias. ¿Cómo están todos?
Muy bien. ¿Qué nos puede decir del problema que está confrontando nuestra comunidad cuando cierran esta clase de facilidad?
Pues sabemos que Kaleida Health le ha pedido al Estado, el Departamento de Salud, el permiso para cerrar este facility ahí en el website. Y la razón por cual lo quieren cerrar es que no están haciendo dinero porque el Estado no está pagando suficiente en el programa de Medicaid. Así que si los pobres, y son los pobres que están en este programa, y lo que va a pasar ahora es que este facilidad se va a cerrar y nosotros vamos a tener que buscar otros lugares donde llevar a nuestros ancianos que necesitan ayuda especial.
Sí. ¿Y cuántos latinos hay ahí en ese
Me imagino que hay muchos latinos como pacientes, igualmente como que trabajadores.
Y esto va a tener un impacto más grande sobre la comunidad nuestra, ¿verdad?
En la comunidad, en la economía y también en la vida de la familia de esos ancianos que viven en ese lugar.
¿Usted cree que realísticamente el Estado va a proveer el dinero que se necesita?
Pues el Estado debe respetar que a nuestros ancianos primeramente, que ellos saben también que tienen padres, abuelos y madres, quizá un día van a estar en una de estas facilidades.
¿Pero usted cree que va a cerrar?
El Kaleida ha pedido permiso. Nosotros estamos diciendo al Estado que por favor no lo permita.
Eso hay posibilidad.
Sí, hay una posibilidad. Ellos necesitan la autoridad del Estado para cerrar.
Ok, muchas gracias.
Gracias.
I'm here representing the Pastors Association of Buffalo, and let's pray. Heavenly Father, in the holy name of Jesus, we come here today, and we are asking you, dear Lord, to support this cause.